what to do, does not know what happens if they don't know what to do, does not know where they take patients if they have messed up. We cannot have such a scenario. So we cannot have the public guessing who is a dentist and who is not. That is why we are saying they need to stop all of that. Hold licensing and registration of these cadres, pending a consultative scope of practice. And what a scope of practice does, it tells you what you can do and what you cannot do based on what you have been taught. We cannot allow patients to be treated by people who are seeing them for the first time in their training. That is dangerous. It is extremely dangerous and unwarranted and unacceptable. We are saying that a scope of practice is a simple document that is created by the professionals, the training staff, and even members of the public are involved because they need to know what they need to be trained on. We need to know what is the problem of oral health in the country. We have 2 dental schools. As of now, one is shut down. We are saying that these dental schools need to be maintained to be able to offer the high standards of training. And that starts with good procurement system which enables them to have the things that they require to be able to send out graduates who are well trained. What we do not want to allow is a scenario whereby we are sending people who have never seen a patient to start seeing patients out there because we know the consequences are devastating. We are currently overseeing some of these complications. Unfortunately, for members of the public, they are not aware. And one of our challenges as an association and something that we are going to take up very seriously is we are going to start public sensitization. We are going to inform the public what are the services available in the field of oral health care. Where can you get these services, both in the public and the private facilities? We are actually in the process of engaging legal services so that we also force the board to do the right thing. Unfortunately, sometimes it comes to that, but the Kenya Dental Association is prepared to go the whole 9 yards because for us, the outcome and the repercussions, if it do not do anything, are very dire. And that leads to public safety, public harm, and we do not want such a scenario. Thank you. The 2 schools that we have offering dental training for dentists are the University of Nairobi, where we are at the moment, and the Moi University. As of now, the Moi University School of Dental Sciences has had to close. And why has it had to close? And this is temporarily, hopefully, because they do not have, for you to be able to see a patient, you need gloves, you need a face mask, you need protection, you need materials to be able to do fillings, you need materials to be able to do extractions, be able to numb the patient. Without this, unfortunately, the guidelines are very clear. You cannot substitute, you cannot start harming patients because you do not have the adequate or the ideal tools that you need. So for that, unfortunately, the Moi School of Dental Sciences has had to close, and it's something that we are looking up, and we wish that the Ministry of Education comes to support, because the same is going to happen to the University of Nairobi. We are seeing students buying materials. Students are not supposed to buy materials. They are supposed to come and learn. If they start buying materials, it becomes expensive. It disadvantages those from a poor background. It makes dentistry the cost for the rich. We do not want that. We want a fair availability of dental service training to everyone in this country, as long as you have qualified and you have gotten the grades necessary to get into dental school. Thank you.